Good day from Australia. It certainly is a pleasure to be able to address you today about what makes nursing informatics a separate discipline. I'm going to be talking about a lot of different concepts that are going to be fairly complex, and all I can really do is provide a bit of an overview, but it should be sufficient to get you started thinking about why nursing informatics is actually a separate discipline and all the other aspects associated with it. So if you're looking at a global perspective about nursing informatics, it really covers everything to do with nursing and everything to do with information technology and communications. And it's about leadership, it's about computing, it's about communication, it's about information, it's about data, it's about knowledge management, and it's about collecting evidence. So it's about the science of nursing as well as the science of all these information and communication technologies. All of these aspects are actually integrated together to develop a whole new discipline of nursing informatics. So the nursing informatics definition that is highly recognised by Staggers and Thompson says that it's a specialty that actually integrates nursing science, computer science and information science to manage and communicate data, information and knowledge in nursing practice. Nursing informatics facilitates the integration of data, information and knowledge to support patients, nurses and other providers in their decision-making in all roles and settings. And this support is accomplished through the use of information structures, information processes and information technology. So it's important to start thinking about nursing practice in the form of what information do nurses actually use and how can we best structure that information to actually enable that to be computerized. So that's the big question about nursing informatics. I'll do this. So nursing informatics initiatives globally, there have been many. First of all, the International Council of Nursing has adopted an eHealth program back in 2011. In Canada, there was an eNursing establishment that has actually was actually set up in 2006, and it was based on focusing on nurses' access, competence and participation in information and communication technology use. And it was important for nurses to actually be able to make good use of the technologies, because as these technologies are being implemented in the health system generally, nurses are very much big users of such systems. And as a consequence, it is important that the systems also support nursing practice. So the Canadian projects that have been developed since that strategy was implemented, and a very important one is the NurseONE-Canadian Health Outcomes for Better Information and Care project, which is about collecting data that actually indicate the health outcomes that have been achieved and how nursing services and nursing care has actually contributed to achieving those health outcomes. So by having better information and improving care, it means that those health outcomes can be improved over time. And they learn about it through this project of collecting the right sort of data and then analysing it and making use of it to actually improve their practice. The Canadian National Nursing Quality Report has indicators. It includes the indicators that are actually used for such projects of actually managing and identifying the quality of care provided. The Registered Nurses Association of Ontario's Nursing Quality Indicators for Reporting and Evaluation Initiatives is another one of those aspects. So the focus in Canada has been very much on identifying the quality of nursing that is being provided, and therefore getting the right information to be able to improve the quality of practice. Also in Canada, they have adopted the International Classification of Nursing Practice terminology as the preferred nursing standard terminology. In Brazil, Nursing Informatics Initiatives began in 1985. Nursing informatics there was included in nursing curricula and postgraduate courses. They now have 21 different nursing informatics research groups. They also use the International Classification of Nursing Practice terminology as well as the Clinical Care Classification terminology that was developed by by Dr. Virginia Saba some years ago, and this is now being implemented in a number of different places as well. In the Philippines, Informatics Nursing Specialist Program has actually recognised clinician researchers and managers, and they have a basic informatics nursing certification. And this was really about making sure that all clinicians and researchers and managers of nursing had the basic knowledge about informatics, and they're actually being certified accordingly. In South Korea, nursing information systems have been in large hospitals since mid-1990s. They now have paperless e-nursing record systems. So again, the use of International Classification of Nursing Practice terminology was part of the work that was undertaken to actually implement and develop, or to develop and implement nursing information systems. And in addition to that, it was discovered that just using the standard data alone was really not enough to really maximize the use of the technologies for knowledge management purposes. So they then have started to use the detailed clinical models or archetypes from 2012 to improve this situation. 69% of the nursing schools in South Korea now include nursing informatics in their programs, including in their master's and doctoral degrees, and they also have nursing informatics research programs. In Portugal, the Nurses Association has documented basic architectural principles and key technical and functional requirements back in 2007. So this includes guidelines for nursing information systems development, and these guidelines have been accepted by the Ministry of Health, and they must be included in contract documents for the health information systems development to ensure that nursing information needs are also being met by these systems, as nurses are big users of these systems. So this is a major coup, I think, for the Portuguese nurses to be able to ensure that all the systems there have actually included in nursing informatics. In Finland, the Nurses Association has an eHealth strategy for nurses as well. They are of the view that nurses need to have informatics and media literacy for such things as the safe care of clients and production of services, as well as the management of services and resources. So their mission is about nurses developing and using eHealth services in caring, rehabilitation, alleviating the suffering and health promotion of clients, and in increasing the well-being of citizens. So this is very much about what nursing practice is all about, except that in this case, it is nursing practice supported by the technologies. So their vision is about nurses are bold in reforming practices, and that they have the skills to use and develop eHealth services on a multi-professional basis and in cooperation with clients and other stakeholders. And that such cooperation is really important because we need to work as a team in all situations of healthcare. So even the patient and the people that we care for must be part of our members of that team, and we need to make sure that they too are able to make use of the technologies so that we can use the technologies collectively and make the best possible use of the available technologies. There are 10 main aims of the Finnish Nurses Association's eHealth strategy, so it's quite a comprehensive document. They also have National Nursing Documentation Model, which is based on the nursing minimum data set. So in other words, that model has been designed to ensure that the minimum nursing data is being collected nationally so that they can actually compare and contrast, and also to support further research in nursing practice. So what do we need to do? Well, a standard nursing language. So when you get started in any aspect of nursing informatics, you need to start thinking about what standard nursing language do you really want to use. And this is because for computers, it's either right or it isn't. It either fits or it doesn't. And therefore, we need to have a very standard way of documenting the care that we provide. Otherwise, if we all name certain concepts in a variety of different ways, then we can't capture that data via computers and actually aggregate the data and make use of it for new knowledge creation. So as June Clark and Norma Lang stated, if we can't name it, we cannot control it, practice it, research it, teach it, finance it, or put it into public policy. So these sentiments were the basis, or formed the basis, for the development of the International Classification of Nursing Practice terminology. And this is really just one terminology that is now in use widely, globally, by many different nurses in different countries. So the International Council of Nurses actually sponsored the development of the International Classification of Nursing Practice, and they have sponsored eHealth generally. So the first version was actually released in 2005, a second version in 2009, and another update in 2013. Now, updates for terminologies are important because, just like any other language, you know, things change, and we have to be able to accommodate new concepts as they become available to us. So with new technologies and changes in the health system generally, we need to make sure that all of these can be incorporated within the terminology in use. So currently, the International Classification of Nursing Practice terminology has a list of 783 nursing diagnosis and outcomes statements and 809 intervention or pre-coordinated statements. Now that means that we have many terms that we have to use, and in many instances we need to combine the terms to actually describe a very specific concept. So for example, if we're looking at wound care, we might want to know the location of the wound. So this is about providing context. So in that instance, you may need to refer to a terminology that refers to the anatomy of a body, so that you can actually identify and say the wound is in this particular area. This is where you need to look for the wound. This is where it is. And by putting those two concepts together, you get a whole new concept. And there may be a variety of different locations, obviously, but the wound and the type of wound may be the same. So when you look at any sort of aspect of nursing, it is about providing context, and this is where those combinations of statements are really important. So as another example, just a very basic one, is that, you know, there are many tables, for example, but tables have different sizes, they are made of different material, they maybe have different colors, and we might want to be able to describe all of those things. We might want to say the size, the shape, the color, the material it's made of. So these are all pre-coordinated statements when you put it all together. Okay, so then the International Council of Nurses eHealth program was actually established in 2011. Now the ICN is actually working with the International Health Terminology Standards Development Organizations, because they look after the systematized nomenclature of medicines clinical terminology, and that needs to be integrated or combined with the terminology that is unique to nursing. And there are a number of overlaps. So they are working together and have developed an equivalency table for nursing interventions between these two terminologies. There is also a memorandum of understanding between the International Council of Nurses, the Telenursing Network, and the International Society for Telemedicine and eHealth. Now again, this is important because nurses are also involved in telenursing, which is about using the telecommunications aspect to provide nursing care or nursing advice, in a variety of different ways. So it may be via call centre, or it may be by nurses in practice in the field actually needing to communicate with expert nurses for specific advice about how to care for a particular patient or a particular instance. The International Classification of Nursing Practice Terminology is also harmonised with SabaCare's Clinical Care Classification System, and it is harmonised with the Unified Medical Language System that has been developed by the National Library of Medicine in Washington, D.C. So as you can see, there is a big focus on standard terminology as a component of nursing informatics. So altogether, to be able to actually express nursing knowledge and skills in a standard manner, we need to have this terminology, and that's the only way that we can actually incorporate all of the skills and knowledge that encompass nursing practice and put it into a computer system so that we can use the documentation that might have been on paper previously now can go into a computer, and that has the additional benefit of actually enabling us to do further analysis and data analytics generally, and performance measurement, and undertake research, etc., so that we can learn more about nursing practice and the impact of nursing practice on our patients. Now, nurses and midwives know a lot about information and communication flows that are associated with any sort of patient journey through any episode of care, because it's nurses who are involved with all patients in a variety of different settings, and they follow patients through. Nursing practice is very unique. It has its own domain of knowledge and skills, and that domain of knowledge and skills needs to be represented in any sort of health system that is used for operational purposes. So even if you don't know much about informatics, you know a lot about your nursing and midwifery practice, and we need to be able to capture that information and that knowledge and put it into a computable form so that we can actually make good use of it. So there are different roles for different people, but we need to work as a team, and therefore it's really important that we focus on the information that nurses need for their patients to provide really good care. So there is very much a discipline of nursing informatics where the nurses and the midwives work with the nurse informaticians to really ensure that they develop systems that support their practice. I wish you well with the conference.